Financial Health Pathways is an organization that not only provides direct services to people, but also advocates to address these big systemic issues that we have in our community. And those issues are always the root cause of a lot of our problems in Texas. My name is Lourdes Zúñiga, and I am the Executive Director and Founder at the Financial Health Pathways. FHP is an organization that really came about from my lived experience as an immigrant in trying to navigate the financial system and finding it extremely difficult. I think that the technical language and the different elements that are not necessarily relevant to people's life is a big barrier when it comes to financial education. The bigger these issues are, the more time we need to build that strategy to tackle them. And when you don't have time, oftentimes that kind of prevents you from innovating. And one of the values of the organization is innovation and collaboration. But to do that, you need a lot of time. So I think that the Makers Residency, what has given me is the discipline to have that time, to look for that time, and to sort out those issues and address the issues that we wanted to address, and not just to provide Band-Aid services that are helping in some way, but really aren't addressing the root cause of the problems and the poverty that we're experiencing in this region. And I think that that is worth taking the steps to make that time. So my concept for the residency was to create a financial ecosystem that will bring intersectional work, different stakeholders from different industries to work together to eradicate poverty. And when I thought of this idea, it was initially an idea that came out of our research. When that concept initially was put together, it was more of Austin-based, but then as we were developing this concept, we thought it would be more a regional thing, and it will have an element of advocacy and also some action items. So throughout the process and the ideation and the prototype, we came with a very interesting concept that is hitting all the boxes of the things that the research said that we have an opportunity to do. My larger goal, I think it is to really implement it with a few partners and see, kind of do the proof of concept. And once we finish the year, I think that we will do some assessment and maybe adjust a little bit, but I'm actually pretty happy with the way it all came about and what it looks like. So yeah, I think that those goals are pretty doable. So I will encourage you to visit our website, www.financialhp.org, and see the great things Financial Health Pathways is doing for our community, and get involved in whichever way you would like to, whether you want to be a donor, a funder, a partner. I would love to hear from you. And obviously stay tuned for our financial ecosystem to be launched and the great things we're going to do for the state of Texas.